Hi, I'm Dr. Lori Bagai from Smart Smile Dental in Orange, California. We get a lot of questions regarding emergency dentistry, and I'm going to talk to you today about emergency dentistry. A dental emergency is usually a toothache. When you're having big toothache or an infection or your tooth broke, anything that you need to see a dentist for right now. Sometimes it could be, simple as a crown came off or, your veneer fell off or something like that. Any of those constitute an emergency dentistry, which basically means, getting it seen right now. In our office, we accommodate emergency dentistry same day always. We will always try and fit you in as long as, it's a working day and we are open. We will always try to fit you in. So you should always try to go see a dentist if possible for your dental emergency because, in the ER, they are treating massive things like, a heart attack or, some major life-threatening issue. Dental emergency is not really a life-threatening emergency unless you have a super bad infection or something like that. Then maybe you can see an emergency dentist, but try to see someone at a dental office if possible. Now, over the weekend, sometimes you need painkillers or you need antibiotics and you cannot find a dentist open, especially like on a long weekend or holiday. Then you can go to the emergency room. But if you try and pay attention to your toothache from before, you will not end up in an emergency room. So if you are starting to have a toothache, if something's starting to bother you, try to find a dentist immediately instead of waiting for it to get really bad. Let me tell you, once a toothache starts, it will not go away unless you see a dentist. Yeah, tooth pain or toothaches. Now, nobody wants a tooth pain or toothache, That's the only reason really dentists exist in the world, because of tooth pain and toothaches. It can drive you nuts and it can be scary. But, if you find a good dentist or come to us, you can be taken out of the tooth pain or the toothache very easily. It's not that scary. My suggestion is, as soon as a tooth pain starts, there is something wrong. A tooth doesn't hurt without a reason. You should immediately find a dentist. Don't wait for it to get any worse or, don't just hide it with some Tylenol or ibuprofen at home or any other ideas that Google gives you. Find a dentist. You need a dentist. Yes, an abscess or swelling means an infection. There are millions and millions of bacteria in your infection. You really need to see a dentist immediately. It's not going to magically go away. It might subside because it drained, but the infection is still there. You need to get whatever's infected treated in order to get out of that infection. Wisdom tooth pain is common because, wisdom teeth are basically getting evoluted out of the human mouth, which basically means that our jaws are getting smaller. There's not enough room in our jaws for the wisdom teeth. It's very, very common to have wisdom teeth issues. The best thing to do is to get yourself checked out when you're having no problems to find out if you will have wisdom teeth issues in the future. That's the best way to do it. But if you're having wisdom tooth pain right now, see your dentist right now. Don't wait, because the wisdom tooth pain can spread into the neck, the head, the ear, and it can be miserable. See someone right away. Bleeding or inflamed gums. I've been a dentist for 33 years, and what surprises me the most is most patients think that it's no big deal to have bleeding or inflamed gums. Let me ask you something. If your hand was bleeding, would it be normal? Would you go to the doctor to see if your hand was bleeding? If it just started bleeding for no reason at all, when you're brushing your teeth and your gums are bleeding, it is a sign of disease. You need to see someone. Don't be scared. It can be easily fixed, but you need to see a dentist. It's not normal for gums to bleed. My gums don't bleed. Tooth sensitivity. Yeah, almost everyone has some kind of tooth sensitivity or other. Now, tooth sensitivity is something that needs to be treated fast. If you have tooth sensitivity, don't ignore it because it's coming from somewhere. So it could be a cavity, it could be gum recession, it could be something else happening, but tooth sensitivity is not normal. It is common, but not normal. It signifies some kind of issue with your tooth. Let's go to the dentist and find out before it's too late. Broken, fractured, or cracked teeth is pretty common. It usually is seen in people who don't go to the dentist regularly, because if you go regularly every 6 months or every 3 months, the dentist can kind of predict that a tooth is going to break, or, there is a fracture line in some tooth, or it can be seen before. Now, if you wait for the crack to fracture, you might even need to get the tooth pulled out. But if you go soon, or if you get attended to, it's possible to save the tooth. Let's not wait till it breaks. Emergency dental extraction. Sometimes people do need emergency dental extractions, usually for whatever reason. Hopefully it's just an infected tooth and not an accident, or, a major accident or something like that. Sometimes, fender benders or car accidents or sporting accidents like, hockey or baseball or anything can cause tooth fractures. Sometimes they do end up in extractions, but sometimes they can be saved. So don't ignore it. Seek attention as soon as possible. Now, if teeth have been infected for a really, really long time and they're blowing in the wind or they're really loose, most likely they need to be extracted, but still it's better to see a dentist sooner than later. Emergency root canals are usually needed when the nerves or the canals of the tooth got infected. Now, you can have pretty bad pain because of that, but the good news is that if the tooth is still sound, you can still save it. And the sooner you go to the dentist, the likelihood of saving the tooth is a lot higher. A root canal is a way of saving a tooth. So let's get you to the dentist right now. In our office, yes, Monday through Friday, we offer same-day care, and, we will always accommodate you in the office. If you're having a toothache, we will attend to you. We will at least provide you with emergency service. We prefer you to come to our office instead of going to an emergency room, because then you are getting treatment done from people who know about teeth. In the ER, the doctors are not trained to see teeth. They will just treat you for pain or infection. They have no clue what's going on with your tooth. If you go to a dental office or come to our office, you will definitely at least find out what's happening with your tooth. So our last appointment of the day is usually at 4 o'clock. We do start very early in the morning at 8 o'clock. So give us a call as soon as you can. We will always fit you into our schedule, and we will see you immediately. We will give you doctor notes for your employer. If you are having an emergency, we will make your employer give you time off. So come on in. We can write notes to your school or, your football coach or whatever it is needed, and we will accommodate you in our office. So we will reach out to you on the weekends, and we will see what is going on. Depending on what's going on, our doctor might call you, or I might call you and see how I can help you. If you're a patient of record, you will always get called by us. If you're a brand new patient, we will see you first thing Monday morning at 8 o'clock and see how we can help you immediately. We love to help you. Come on in. I hope I've been able to answer some of your questions. And if you have any further questions, give us a call at 714-744-1242. We love helping you, and we are always there for you. We are not scary. We are very nice, and we will help you. We will take care of you just like we would take care of our family. Come on in.